Hi, I'm Dr. Brian Smith. I'm a chiropractic physician, and since 1990 I've seen several thousand patients with a variety of different conditions. A vast number of them, whether they were seeing me for pain, numbness or tingling, fatigue, headaches, balance disorders, or any other number of things, had their conditions made worse by blood sugar problems. Sometimes they were even caused by blood sugar problems. Because these problems are so rampant, I've taken postgraduate training in functional endocrinology, functional blood work analysis, and nutrition to go along with my undergraduate degree from Rutgers University in biochemistry. Now, all of this training and experience has enabled me to adopt a very unique approach to handling blood sugar problems like type 2 diabetes, like metabolic syndrome, like insulin resistance. Now, before we go any further, I want to let you know that I am not going to tell you to stop taking your medication. That's between you and your medical doctor. The approach I use will work to normalize your blood sugar, and as it normalizes, your medical doctor can adjust your medications if necessary. Whether you've been told you have type 2 diabetes, pre-diabetes, metabolic syndrome, or insulin resistance, those things are just labels. You are not your diagnosis. Those labels do not in any way do justice to the complexity of dealing with blood sugar issues like type 2 diabetes. That's what makes this program I use unique. We look at you. I treat you, not your diagnosis. I treat the person, not their disease. I want to treat you, not your diabetes, not your pre-diabetes or metabolic syndrome or insulin resistance. You see, there are so many different things involved in treating type 2 diabetes or pre-diabetic conditions such as insulin resistance. Unfortunately, if you're like most people, you'll tell me that you were hustled in and out of your doctor's appointment in 10 minutes or less because your doctor pretty much knew what was going on with you. You're a little overweight, you're in your 30s, your 40s, your 50s, and they prejudged you. They said, I know what the deal is. You eat too much, you probably drink a little too much, you don't exercise enough, that's the problem. I'll tell you what, why don't you eat a little better, get some exercise, take these pills, you'll be fine. Goodbye, next patient please. You know what? It's much more complicated than that. Sure, maybe you ate some junk food, maybe you had some stress, maybe you had a drink or two, and you didn't exercise. But is that the whole story? There's so much more involved in dealing with type 2 diabetes, dealing with metabolic syndrome and insulin resistance, and other blood sugar issues. You see, liver function, cortisol, adrenal gland health, thyroid function, bacterial infections, and inflammation can all be the underlying cause of your blood sugar issues. That's where I'm different. I try to dig for the cause of what's causing your blood sugar imbalance. And that's why this approach has had such great success with people who've been labeled with type 2 diabetes, labeled with metabolic syndrome or insulin resistance. We look at you and not your diagnosis. Let's talk about different types of blood sugar problems. The most widely known one is diabetes. Now, diabetes is a disease characterized by high blood glucose levels that result from the body's inability to produce or utilize insulin. Diabetes is usually diagnosed by checking someone's fasting blood glucose levels and having those levels be above 127. And you want to have more than one test above 127 before you're officially diagnosed with having diabetes. Now, type 1 diabetes is an autoimmune disease. That means your body is attacking itself. It's an autoimmune disease where your immune system begins to attack your pancreas or even your insulin. It destroys your body's ability to produce insulin. And it's commonly thought to develop in childhood, hence the name juvenile diabetes. However, more and more it is being seen to develop in adults in this country. Now, type 2 diabetes occurs when the pancreas can no longer produce insulin, or the insulin that it's producing is no longer effective. It can't get the blood glucose into the cells. It's also known as adult onset diabetes, but again, unfortunately in our country, because of our lifestyles, more and more children are developing this. Kids 10 years old and even younger. Now, diabetes facts. Here's what happens. Diabetes or diabetes combined with insulin resistance, is the #1 cause of new blindness in this country every single year. People who aren't born blind, but people who develop blindness as they're alive, that comes, the #1 cause is diabetes or blood sugar problems. The #1 cause of kidney failure in this country is blood sugar problems. The #1 cause of amputation, the loss of limb in this country, is due to diabetes and blood sugar problems. If you add all this up, it's the #7 cause of death, blood sugar. #7 cause of death in the United States every single year. There are 23.7 million Americans who've been diagnosed with diabetes. Or actually, I shouldn't say they've been diagnosed. They have diabetes because unfortunately, 1/3 of those people don't even know they have it. They're undiagnosed. This is expected to double in the next 20 years. Now, it costs $133 billion a year to treat diabetes. Over the next 25 years, that cost is expected to triple. Think about it. 1/3 of $1 trillion, that's trillion with a T, dollars a year just to treat diabetes. Now, 25% of the people in America are estimated to have metabolic syndrome. And we're going to talk about that in just a bit. But when you add all the numbers up, between diabetics and people with metabolic syndrome, you're talking 100 million people in our country have problems with blood sugar. That's 1 out of 3 people. Now, we've been talking about insulin resistance, metabolic syndrome. What is insulin resistance? Well, it's simple. When your insulin levels are high for a long period of time, your cells begin to ignore the insulin. It's like when you sit next to a person who's talking constantly. At first you pay attention to them, but after a while you start to tune out. When you tune out, what do they usually do? They start to talk louder. And you listen to them a little bit more, you tune out some more, and they start to speak even louder. Same thing happens with your cells. They start to tune the insulin out. So your pancreas makes more. The cells tune the insulin out even more, so the pancreas makes even more and more insulin. Eventually the pancreas can't keep up with it, and it burns out. It loses its ability to produce insulin, and that's when you become diabetic. So insulin resistance is a pre-diabetic condition. Now, metabolic syndrome. What is that? It's a series or a group of symptoms that can cause major problems. People who have metabolic syndrome have abdominal obesity, large stomachs, high blood pressure, high cholesterol, and high blood glucose. If you have all of those going on, you have metabolic syndrome. Why is that important? Because people who have metabolic syndrome are at extremely high risk for developing type 2 diabetes, heart disease, blood clots, and stroke. Now, what are the causes and contributing factors? How do you get these blood sugar problems? It's not just diet and exercise. They're very, very important, don't get me wrong, but they're not the only factor. #1 factor, cortisol and adrenal health. Cortisol is intimately tied to your body's ability to regulate its blood sugar. Cortisol is a hormone produced by the adrenal glands in response to stress. When you're under stress, high levels of cortisol are produced, your blood sugar goes up, your blood pressure goes up. And when that happens for a long period of time, just like your pancreas, your adrenal glands start to get weak. They get tired, they get fatigued, and then you have the problem of not being able to produce enough cortisol. Your liver. Okay, why is your liver so important? Well, your liver takes excess blood sugar that can't get into the cells, and turns it into fat. Your liver also takes fat, breaks it down, and turns it into glucose. So your liver helps regulate your blood sugar. If there's a problem with the liver, there can be a problem with the blood sugar. Food sensitivities. Every time you eat something that you're sensitive to, it's going to drive your immune system. It's going to overstimulate your immune system, cause inflammation, and your blood sugar is going to spike. Infections. Quite often people have low-level chronic infections that, again, are overstimulating the immune system and driving the blood sugar up. Autoimmune diseases, things like rheumatoid arthritis, Hashimoto's disease, multiple sclerosis, lupus, these autoimmune diseases where the body's attacking itself, again, the immune system's out of control, and that's going to drive the blood sugar up. And again, finally, pain. If you're in pain, that's a form of stress. Stress elevates your blood sugar. So if you don't handle the pain, it's difficult to get your blood sugar under control. So why should you worry if you have high blood sugar? I know quite a few people really don't pay it the attention that it deserves. They say, well, yeah, I really need to get around to eating better and exercising, but quite often they don't do anything about it. Why is it so serious? Why should you pay more attention to it? Well, it's simple. High insulin levels, whether it's produced naturally by the pancreas or taken as a medication, injected, people who are already diabetic may inject insulin. It can have many adverse side effects when those insulin levels are higher than normal. And if you're injecting it, you're taking higher than normal levels. If you're insulin resistant, you have higher than normal levels. Now, it causes an increased risk of cardiovascular disease. High levels of insulin can cause high blood pressure, increased cholesterol, decreased HDL, that's the good cholesterol in your body, and it also causes an increased risk of blood coagulation. Translation, increased risk of blood clots. Now, in females, increased insulin stimulates the conversion of estrogen, the main female hormone, to testosterone, which is the main male hormone. This can lead to unwanted weight gain, unwanted hair growth, and more seriously, polycystic ovary syndrome, infertility, mood swings, and more. Now, in males, the opposite happens. Insulin surges convert testosterone into estrogen. In men, this leads to heart problems, weight gain, hair loss, prostate problems, loss of libido, and sexual dysfunction. High levels of insulin will also affect your liver. Okay, it is going to lower your liver's ability to detoxify the body, as well as your liver's ability to produce and process cholesterol. Now, high levels of insulin also stimulate inflammation. One of the ways it does this is by turning otherwise healthy fatty acids. These are the omega-3 fatty acids that everyone tells you should get through your diet by eating fish or by taking supplements. It turns these into chemicals that cause inflammation. Chronic inflammation not only leads to chronic pain and stiffness, but also to heart disease and nervous system problems, among other things. Nervous system problems, here's two main ones. Neuropathy. 60 to 70% of all type 2 diabetics suffer from neuropathy. Neuropathy is a condition where the nerves begin to degenerate. It ends up leading to numbness, tingling, pain, often severe pain, and loss of muscle strength, and even loss of balance. Now, dementia. The number one type of dementia in the country is Alzheimer's. The inflammation caused by high levels of insulin is the type of inflammation that can cause the degeneration of the brain that happens with Alzheimer's.